Teresa Flavin first noticed signs of memory loss when she was in her 40s.
Everything was falling apart. Birthdays were being forgotten. All of the normal routine things.
She was referred to mental health services before being diagnosed with dementia years later.
The diagnosis process is so exhausting and so demoralising.
This is the Roche Diagnostics Analyzer.
A less arduous process may soon be available after the TGA approved a new blood test which can identify Alzheimer's disease at least 20 years before symptoms appear.
This is a simple blood test that can be organised at a pathology centre. It identifies tau in the blood, and that's the protein that affects the brain, causing Alzheimer's disease.
Results can be determined in the lab in as little as 18 minutes. Currently, the best way to detect Alzheimer's is through an expensive and invasive brain scan or spinal fluid sample.
And it's the earlier diagnosis that's going to have the biggest impact on treating and eventually curing and preventing Alzheimer's disease.
Dementia is now the leading cause of death in Australia, affecting more than 400,000 people. Around 2/3 of those have Alzheimer's disease.
This is a tragedy that can hit so many families, and this breakthrough today is really important.
This diagnostic holds out the prospect of a quicker answer to the question about what's happening with your loved one. And that's why I really describe this as the holy grail.
The test is now part of clinical trials, with blood samples to be analysed here in the coming weeks. The hope is that the test will ultimately be available to the general public and be subsidised under Medicare. There is no cure for dementia, but Teresa Flavin knows an early diagnosis can be life-changing. Lydia Feng, ABC News, Sydney.